What if I told you back in 2006 you could train in emergency medicine, radiology, medicine, and even surgical specialties in the main cities as an IMG? Can you believe that there was no APRA but only state medical boards? All you had to do is demonstrate your functional English by doing IELTS, which even then was very hard at that point. And that IELTS would let you apply for jobs. Now, if you go even back to 20 or 30 years, the GP who came to Australia never did any exit fellowship exam, as RACGP did not exist, and were granted general registration to work as a specialist GP's residency, along by being given permanent residency to take up and set up their multiple practices based on just their MBBS only from back home in Pakistan and India. Changes, good or bad, are inevitable. And in these times, for competitive and highly skilled jobs like doctors, challenges are going to get harder. You're right. Today, we're diving into some exciting changes and some not so very exciting changes coming in 2025 for international medical graduates looking to work in Australia. So whether you're a junior doctor, a specialist, or a GP, these updates will impact your journey in a very real way. So stick around to get the full scope of how to navigate these changes and make sure that you are prepared for the road ahead. So let's dive deep into it. So for the ease of conversation, I'll divide this talk into junior doctors, changes for GPs, changes for specialists, what to expect and how to gear yourself for those things, and how's job situation going to look like, and finally, I'll lay out my conclusion too. First up, let's talk about junior doctors. The number of international doctors coming to Australia continue to rise significantly each year. According to the latest data from APRA, we're seeing a steady increase in application, which means more competition for those who are at all important first jobs. If you're a junior doctor looking to secure your first job in Australia, the AMC Clinical is going to be a crucial part of your journey. In 2025, the importance of exam is rising alongside the need for the clinical experience. You will ideally also need a minimum of 24 months of clinical experience, which includes an internship and some resident medical officer work back home in your own country. And the life support courses, as I always said, like ALS and BLS, ACLS, ATLS, EMST, all of these courses are relevant. And you know what I've observed by doing the practice interview sessions for multiple doctors, most of these doctors who were shortlisted were at least 2 years out. That is completion of their medical degree, completion of an intern, and at least 1 to 1.5 years working as resident medical officer. On top of that, you will also need to demonstrate your understanding of the Australian healthcare system. Now, this is something which is now slowly showing its way to become more of an essential criteria. Now, how do you achieve that? Now, this can be done through clinical observation. Now, these are the placement that you do in a local GP practice or hospital, and there are also designated international clinical readiness program here in New South Wales and in various states of Australia. Also participating in continuous professional development, which are Australia specific, and these activities and enrolling in clinical observation along with local procedure and communication skills courses are always going to bump up your CV, making sure that you are going to get shortlisted. So if you're preparing for a junior doctor role, get ready to step up your game, polish your CV, and build your experience and sharpen those interview skills. That's right. I've seen countless doctors who've been shortlisted, and fortunately so, multiple times. But interview, it just falls flat. So make sure that you practice. It's a real deal. It's a lot of preparation. So make sure that you practice those interview skills, because the competition is going to get tougher for junior doctors. And perhaps this is the only space where the competition is going to be the most fierce one. You're going to get the competition from the junior doctors and also from the specialists. Now, general practitioners, GP fast track opportunities and incentives. Now, as you know, I've talked in my previous videos that there's expedited pathway coming in. So medical professionals or GPs from UK, Ireland, and New Zealand. If you're a GP from UK, Ireland, New Zealand, Australia has some great news. And that is new expedited specialist pathway for GPs that will fast track your registration, cutting down unnecessary barriers so you can start seeing your patients sooner. Now, from October 21st, 2024, GPs are with specific pre-approved qualifications can apply directly to the Medical Board of Australia, that is APRA, For example, if you hold a membership of Irish College of General Practitioner, MICGP, or fellowship of Royal New Zealand College of General Practitioner, you are eligible for this fast track process. This is going to be a game changer for the GPs looking to relocate from Australia, but previously were held down by this meticulous paperwork through RACGP. But that's not all. Australia is pushing to get more GPs into rural areas, and they're going to offer pretty attractive incentive. So if you're open to work in slightly more regional and rural locations, you could receive relocation bonuses between 10 to 20,000 and minimum guaranteed income of $155 to up to $160 per hour for the first few months, whilst you built up your own patient base. Now, I was recently contacted by one of the GP owners in MM5 location. Now, that's a location which is at least 4 to 5 hours from the major city like Sydney or Melbourne, who is willing to sponsor for PR from your home country location, and also giving a house and a car, and provide all the training necessary for the GP exams in his established practice. Not only that, he said that, look, I also admit patients in the local hospital, so I'll also train the doctors how to admit the patients and have an additional income from hospital admissions. Now, this practice was close to about 3-hour drive from Adelaide, so it is quite rural, don't get me wrong. But the incentive for those 3 years to build up your patient base, to relocate, pass your exam, and also get a permanent residency and potentially a passport are a major deal. If you're looking to fast track your path to permanent residency, working in MM5 plus location could help secure a permanent visa directly from your home country. So for the GPs, the opportunities in 2025 are incredible. Just make sure that you evaluate your contracts carefully, considering things like supervisor, support, steady patient flow, and local amenities. We also offer, the contract reviews and give you some guidance in terms of whether this job could be potentially good based on your personal circumstances or not. So please feel free to reach out to us, info@emergencyfocus.net. Now, specialist. Australia is introducing new expedited specialist pathway, making it easier for international medical specialists for similar healthcare system to get registered and start working faster, same as GPs. This is a huge shift for fields like anesthesia, obstetrics, and gynecology and psychiatry. Here's how it's going to work. If you hold one of the qualification from pre-approved list, you can apply directly to the medical board, bypassing the lengthy specialist college assessment. This pathway is specifically designed to reduce the regulatory barriers and increase the number of specialists treating patients in the regional and rural part of Australia. However, the process is still quite rigorous. Each specialist will need to undergo a 6-month supervised period, complete an orientation to the Australian healthcare system, and meet strict standards including English language proficiency, criminal history checks, mandatory cultural safety education. Now, if you're a specialist looking to come to Australia in 2025, start preparing now. This streamlined process could be your fast track to start your practicing here in Australia, and as I said, in regional and rural setting, not everywhere. What's the job situation going to be like? Now, I'm going to give you tips for all doctors, the junior doctors, the GPs, and specialists. Now, let's go over a few key tips that I've strategized for you. Apply widely. Don't just apply to the handful of jobs. You should be applying to as many jobs and as many positions which are tailored to your skill set. Sending 6 and 10 applications a month is just not enough in this very competitive environment and landscape. Improve your CV and interview skills. Having an excellent CV and a solid interview skills is non-negotiable. If you're struggling with interviews, it's crucial to practice and seek professional help. Many highly skilled doctors miss out on opportunities because of poor interview preparation. And I'll tell you what, interviews are all about, your personal behavioral aspects, the cultural competencies, the clinical governance, and how you handle stressful situation by clinical prioritization and delegation. And they are very specific set of questions, which if you're not prepared for, you're just going to come undone, and you're just going to look very shallow and never get a job. And then you'll blame the system that I had the specialist comparability outcome and I could never get a job. Now, utilize local networks. Yes, if you can engage in clinical observation or attend local CPD courses to network with Australian healthcare professionals like doctors and other staff, This networking can make a huge difference when it comes to job opportunities, and I've seen that. The doctors who have taken the effort of coming over here, doing a slight bit of orientation, they have stood out and they have managed to get shortlisted earlier than anybody else. Now I'm going to say something that the specialists may not like. Consider AMC1 for specialists, and this is especially true for those specialists who are on competitive specialties like surgery, anesthesia, and dermatology. And I would also put certain niche specialties in medicine like gastroenterology or cardiology. Now, this is not a rule, but this is an exception. If you want to leave your country after a specialist comparability outcome, that is successful specialist comparability outcome, and you want to utilize better opportunities, then please do apply for AMC1. Now, taking the AMC1 can drastically improve your chances of landing a job. It is a simple exam that only takes a few months of preparation, and it opens up more job opportunities. And I often give an example of a pyramid. When you pass AMC1, you're at the bottom of the pyramid, and there are thousands of jobs. You can apply for RMO, SRMO, registrar, unaccredited trainee in any specialty relevant to your field. If you're a cardiologist or gastroenterologist or respiratory specialist, you can apply for medical registrar position, which are more in abundance compared to those niche specialties. And plus, not only that, there's another additional advantage. If you get that broad baseline job at the bottom of the pyramid, you're actually earning. And when you're earning, you're able to dispense some money for specialist assessment if you're thinking down that line. And many of the doctors have actually done that. So what's the final word? 2025 is going to be a pivotal year for international medical graduates coming to Australia. With the new pathways, fast track opportunities, and increasing competition, preparation is the key. Make sure you stay on top of your exams, clinical experience, and networking to land the role you want. Thanks for watching the video, and remember, as always, look after yourself and each other, and I'll catch you in the next video. Goodbye.